you ever heard of diabetes? It is a chronic medical condition that changes the way human bodies break down food. When food is taken into the human body, it is usually broken into a sugar known as glucose. Glucose then enters the bloodstream, making your blood sugar rise. This triggers the release of insulin. But with diabetes, your body doesn't make enough insulin or can't use it efficiently. I chose this topic because it is a big thing that affects many types of people. There are two types of diabetes. One you are born with, and one is caused by lifestyle. Type 1 diabetes is genetic and can occur for no prior reason. In type 1 diabetes, the body has an autoimmune reaction which causes the end in production of insulin. Type 2 diabetes is often diagnosed later in life and is frequently linked to the person's lifestyle. In type 2 diabetes, the body does not use its insulin well. Even in type 2 diabetes, there are some risk factors other than lifestyle that may put you more at risk. There are some more subcategories of diabetes. These include gestational diabetes and prediabetes. Gestational diabetes is diabetes you are diagnosed with while pregnant. In America, around 2 to 10% of pregnancies are diagnosed with gestational diabetes. The cause is the human body not producing enough insulin for two people. Prediabetes is basically exactly what it sounds like. It is when your blood sugar is considered dangerously high, but not high enough to be diagnosed as type 2 diabetic. Most people with prediabetes end up with diabetes. About 1 in 10 Americans suffer from diabetes. 90 to 95% of these people suffer from type 2. 1.4 million Americans are diagnosed with diabetes every year. The race with the most cases of diabetes are Native Americans. It was the 7th leading cause of death in the U.S. in 2019. There are many tests, reasons, and timelines for diagnosing diabetes. Some tests include the fasting plasma glucose test and the A1C test. For the fasting blood sugar test, a normal level would be anything less than 100 milligrams per deciliter. The prediabetes level would be anywhere from 100 to 125 milligrams per deciliter, and anything over 126 is diagnosed as type 2 diabetic. A1C tests measure your blood sugar level over multiple months. An A1C level lower than 5.7% is normal, and anything over 6.5% tells your doctor you have diabetes. Symptoms of diabetes that may motivate your doctor to test you are having to urinate a lot, extreme thirst, weight loss, blurry vision, and often feeling tired. There is no known way at this time to prevent type 1 diabetes because it is genetic. Type 2 diabetes can be prevented through lifestyle changes. Treatment of diabetes is a very expensive process. The average person diagnosed with diabetes has about $16,752 worth of medical bills each year. The total cost of diabetes is $327 billion in America and $1.3 trillion worldwide. People without insurance that are diagnosed with diabetes run the risk of out-of-pocket hospital bills. This can cause them to take much worse care of themselves. Ultimately, this can lead to emergency visits and bills that are much higher. There are many stigmas and stereotypes surrounding diabetes. The average person has an image of what a person with diabetes looks like in their mind. Many people believe that all people with diabetes are overweight and lazy with a terrible diet and lifestyle. This is not true. There are many reasons other than lifestyle that someone may be diagnosed with diabetes. Some include age, history in your family, ethnicity, and having been diagnosed with gestational diabetes. In conclusion, diabetes is a very risky and life-taking disease. This condition should be given more attention and awareness. Americans and the world as a whole need to take the threat of this disease more seriously.